changes at the educational level will affect the physiotherapists of tomorrow. Physiotherapy students who are exposed early to the disability, chronic disease, and geographical barriers of the Indigenous community will walk into their clinical practice more prepared to face these issues. In a 2016 study, 19 healthcare professionals, both of Indigenous and non-Indigenous backgrounds, were interviewed about their experiences working in the Canadian healthcare system. All of them agreed that they wish they had been exposed early in their education to some of the issues they would help their future patients address. One memorable quote from the article reads, "Physiotherapists have a huge role to play in improving Indigenous health. Physios, together with an integrated traditional knowledge, can develop culturally specific obesity management treatment plans. From a prevention standpoint, who better to do that than physios?" Within the essential competency profile for physiotherapy, it states very clearly that we are to be advocates. So, where there are no services available, health and all rehabilitation-related professions should receive early education in certain key areas of the history of colonization. This chart, developed by Hajati and colleagues, highlights 4 key areas that educational institutions should work into their curriculum.
Cultural safety is defined as a setting that is spiritually, socially, physically, and emotionally safe for people, and where there is no challenge or denial of anyone's identity. Not only is a culturally safe environment accepting, it is also educated. In 2019, Interior Health composed a video on how to create a culturally safe environment for Indigenous peoples. The video includes acknowledging power differentials that may exist between Aboriginal people and health providers, acknowledging your own biases that you may possess or have been exposed to, and being open in terms of communication. This can include asking the patients how they identify and asking them if they have received appropriate cultural support. This also involves being aware of the historical and political factors that create health inequities in certain populations. As mentioned previously, this dates back to the residential school system. When reflecting on this time period, be sure to acknowledge the resilience of the Indigenous residential school survivors, as well as the impact that is still being had by school survivors and their families. Indigenous people interviewed expressed that acknowledging this period as a time of resilience as well as hardship is more likely to create an environment of mutual empowerment. In keeping with these ideas, health providers will be able to achieve cultural humility, an environment that is open, self-aware, egoless, supportive, and reflective.